Consumer Reports and Consumer Reports Health presents Healthcare, Making Healthy Choices.
Hi, I'm Orly Avitzer, Consumer Reports medical advisor and a practicing physician. When I see patients, I often spend time talking with them about the importance of making informed choices about any medical treatments or tests they might be considering. In those discussions, I advise my patients that it's just as important to avoid overtreatment as it is to get the right treatment. For example, when I have a patient with low back pain, I don't usually recommend an MRI or any other imaging tests right away, but rather encourage my patient to remain active and avoid bed rest. This is because imaging tests have risks, can cost a lot, and can lead to surgery that may not be needed. My opinion on this and about many more overly used medical tests and treatments are backed up by the Choosing Wisely campaign, a national campaign that Consumer Reports is part of, along with over almost 500,000 doctors. The video you're about to see tells you more about why it's so important to talk with your doctor and ask questions about any medical tests, treatments, or procedures you're considering.
How we access healthcare, how we see quality, and how we pay for care, this is all changing in the dynamic healthcare system. There are now more options and more decisions consumers have to make about their own healthcare than ever before. To be able to make good decisions for yourself and your family, you need credible information and guidance about the quality and cost of healthcare. Consumer Reports has been a trusted, independent, unbiased voice in healthcare since their very first magazine in 1936. They, in cooperation with your employer, have created this presentation to help you make informed, quality decisions about your own healthcare. When it comes to cars, consumers often believe a more expensive model is better. With TVs, to get the most advanced model you want, consumers often expect we're going to have to pay more. And in healthcare, many of us believe the more care we get and the more money it costs, the better the results. Not exactly. Our health is not like a car or a television. In healthcare, more is not always better. Too much treatment can be unhelpful, and it can be dangerous. Let's say your child bumps her head. You are concerned there may be something wrong, even though your child shows no symptoms. You think you should get a CT scan to make sure. In this case, if your doctor does not find any worrisome signs, the best course of action may be to carefully watch your child. Why? Because a CT scan exposes your body to radiation and is not worth the risk when your doctor sees no signs of trouble. Plus, there's the possibility you can get what's called a false positive result, which can lead you down a path of more tests, treatments, even surgeries that you may not need. Much of the time, if non-invasive approaches are used, you will get better with time. Experts agree that 30% of healthcare is wasteful. We're getting lots of tests and treatments we don't need, and not getting some we do. So, before you agree to a test or treatment for yourself or a family member, ask your doctor about the risks, benefits, and options, and choose wisely about whether you want to proceed or not. This not only keeps you healthy, but saves you money.